If strategic management is the brain of a healthcare organization, then functional management is the central nervous system. It's the discipline that ensures all the critical activities, from daily decisions to major projects, are coordinated and effective. Strong functional management is what translates high-level strategy into tangible results. It directly improves patient care, boosts staff performance, and drives our overall organizational effectiveness. Today, we'll explore 4 core pillars that make this happen: decision-making, project management, performance management, and communication. Part 1. Decision-making and problem-solving, the core of leadership. At the heart of every management action is a decision. But what's the difference between decision-making and problem-solving? Decision-making is the act of choosing the best alternative among options. Problem-solving is the broader process of identifying the root cause of an issue and creating a solution. They are deeply connected. A problem often triggers the need for a critical decision. Every decision we make is shaped by 4 elements. 1. The problem itself. We must understand it clearly. 2. The decision maker. Our own knowledge, skills, and values shape the choice. 3. The implementation process. The steps we take to act. 4. The environment, both internal and external factors that influence the outcome. Decisions can be classified by their content, their frequency, and their strategic impact. But the process for solving problems is consistent. We must: 1. Identify the problem accurately. 2. Analyze its root causes. 3. Develop alternative solutions. 4. Select the best one. 5. Implement it effectively. 6. And crucially, evaluate the results. A key to unlocking better problem solving is employee empowerment. When we encourage our frontline staff to contribute, we tap into a wellspring of innovation and ownership. This collective knowledge improves service quality, builds trust, and makes our entire organization more effective. Part 2. Project management, delivering change successfully. In healthcare, we are constantly launching new initiatives: a new hospital wing, a digital health system, a community health campaign. Project management is the structured approach that ensures these endeavors succeed. A project is defined by its unique objectives, its set time frame, and its use of specific resources. It's complex, involves many stakeholders, and always carries an element of risk. A robust framework, like the one from Guido and Clemens, guides us through: A. Proposal preparation, analyzing needs and building a compelling case. B. Project planning, defining the scope, budget, and breaking down the work. C. Project performance, executing the tasks and monitoring progress. D. Project finalization, delivering the outcome and closing the project. E. Project review, assessing what worked and documenting lessons for the future. The benefits are clear: efficient use of resources, reduced risks, improved patient outcomes, and a culture of accountability. Part 3. Performance management, aligning our efforts for excellence. How do we ensure that every single team member is rowing in the same direction? Through performance management. This is not an annual event, but a continuous process of translating organizational goals into individual and departmental objectives. Its key features are: goal alignment, so everyone understands how their work contributes to the mission. Clarity of expectations, so staff know what is expected of them. Continuous monitoring and feedback for constant improvement. The performance management cycle is a loop. We plan the goals, monitor progress, measure with key performance indicators, review the results, and report on outcomes. When done well, it motivates employees, clarifies goals, and enhances our strategic focus. The challenges, like staff resistance or poor data systems, are real, but they are hurdles we must overcome to achieve excellence. Part 4. Communication management, the lifeline of healthcare. Finally, we come to the absolute bedrock of everything we do: communication. It is the lifeline that connects every part of our organization, from clinical staff to patients, from administrators to the community. Without effective communication, mistakes happen, trust erodes, and the quality of care plummets. The purpose of communication management is to strengthen this flow of information. Yet, we face significant barriers every day. Physical barriers like noise and distance, psychological barriers like stress and bias, semantic barriers like complex medical jargon. We manage communication across several critical dimensions. Patient records. Management, ensuring accurate, legally compliant records for continuity of care. Clinical information management, providing clinicians with timely, relevant data for decision-making. Knowledge management, capturing and sharing best practices and innovations. Informal internal communication, fostering the teamwork and trust that formal systems can't. Public relations, protecting our organization's image and building public trust. On telemedicine, using technology to expand access and provide reliable health information. In conclusion, functional management is the engine room of our healthcare organization. It is the disciplined, day-to-day work of making smart decisions, delivering successful projects, managing our performance, and communicating with clarity and purpose. By mastering these 4 pillars, we don't just manage an organization, we build a resilient, efficient, and truly patient-centered system that everyone can be proud of. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.